Okay, so you've decided to have surgery. That's a big decision. I want you to think carefully about this because it's a choice that cannot be undone. Most patients who have undergone a hip or knee replacement are incredibly thankful and are happy with their new joints. However, I want to emphasize that the recovery is not a walk in the park, especially in the first few weeks after a knee replacement. When patients rave about their hip or knee replacement, they're usually well into the recovery and have forgotten the initial struggles. The early recovery period is real and should not be taken lightly. It is important to note that a hip or knee replacement should only be performed as a last case resort. Please don't request surgery if you've only had pain for 6 weeks. You'd be amazed how many times I turned down patients because their surgery wasn't appropriate for their stage of arthritis. Now that we've both decided that surgery is the right choice for you, let's talk about what to expect next. If you've just scheduled surgery, you might be feeling a little unprepared. Rest assured, a lot will happen in the next few weeks to get you ready. As the saying goes, it takes a village. And as a high-volume hip or knee replacement surgeon, I have an amazing team. I'm surrounded by wonderful physician assistants, nurses, therapists, educators, all of whom will get you through this process with me. You'll likely meet my nurses who will be your resource for clinical questions and respond to your MyChart messages. Soon, my surgery scheduler will contact you to discuss the logistics, such as the surgery date and non-clinical questions you may have. In the weeks leading up to your surgery, you'll complete various labs and tests, including a CT scan, to facilitate robotic surgery. I will use the CT scan to build a three-dimensional model of your hip or knee to perform the surgery robotically. Similar to an architect designing a house on a computer, I too will design your hip or knee replacement digitally. You'll also visit our PAT or pre-admission testing department, where you'll review labs, medical history, and discuss anesthesia-related questions. You may also need to see your family doctor for a medical clearance to assure that you are appropriate for surgery. Additionally, we offer a teaching class where we educate you about becoming a hip or knee replacement patient. And finally, about 7 to 10 days before surgery, you'll have an opportunity to visit again with me or one of my physician assistants for a pre-op visit to discuss the remaining questions you may have. Feeling overwhelmed? Don't worry, we're here to help you through it. The good news is that we are a high-volume center, which has allowed us to optimize the process for a successful recovery. We're here for you every step of the way.